Cradle cap is a common skin condition in newborns and is caused by overactive oil glands, and it can look like dry, greasy, scaly, yellow, crusty patches of skin on your newborn scalp. It can start as early as the first week or two of a baby's life and can show up at any point in a newborn's life in the first few months. Now, cradle cap can show up once and heal and go away, or it can come and go multiple times in a baby's first few months of life. Now, it's not contagious and it doesn't really hurt and it doesn't itch for most babies. And really, the only time a doctor needs to be involved is if it's affecting their face or the rest of their body, or it's becoming red or inflamed. Now, to treat it, you want to wash the area with a mild, gentle baby soap a few times a week, and then you can use a soft baby brush to loosen up some of the flakes. Now, you want to avoid excessive brushing and avoid aggressive friction or scraping or picking at the crusty patches to avoid infection or irritation. And sometimes it can be really helpful to use some kind of a natural oil like coconut oil and place that on the cradle cap about 15 minutes before you wash the area so it can help loosen and soften some of those flakes. Now, you want to avoid using lotion because it doesn't break down the flakes at all and it probably won't absorb into the scaly skin. Now, there's no set time of exactly when cradle cap goes away, but it does clear up on its own over time with gentle care. Now, when it comes to cradle cap shampoos, they are designed to be slightly acidic and have a lower pH to help loosen up those scaly, crusty patches and to help treat that area without any irritation. So when you're trying to figure out which shampoo is the best to use one that's specifically labeled to treat cradle cap, or even using a regular baby Johnson & Johnson shampoo usually has a more acidic base and does well with treating cradle cap for many babies.